Welcome to Start Before You're Ready, the podcast that proves that you don't need to wait for the perfect moment to begin your journey towards better health and happiness. I'm your host, Kelly Young. Remember, the first step is often the hardest, but it's always worth taking. Hey guys, it's Kelly, and I'm back with an episode of Start Before You're Ready that is going to benefit you. So listen up. I am here with Viraj Chang, and many of you have met her because she has actually come into our studio and done some workshops that were wildly popular and highly attended. And she's worked with several of our clients since we met last year, and the reviews have been through the roof. Everybody raves about her. They say, Kelly, you need to have her on. She is amazing. She's a wealth of knowledge. And here she is today. So I'm going to do a quick intro, and then I'm going to let her talk because we want to get everything we can from this conversation. So Viraj is a physical therapist, and she's the owner of Accelerate Physical Therapy in Ashburn, Virginia. She holds credentials as a physical therapist and Body Arts and Science International Clinical Pilates instructor, which I just think is the best combination. She brings over 20 years of clinical and fitness experience to her practice. She specializes in pelvic floor physical therapy, orthopedic injury, rehabilitation, and preventive wellness. Through her practice, Viraj has helped hundreds of men and women solve their chronic pelvic floor and orthopedic issues, her unique biomechanical lens. She drives clinical innovation by completely replacing industry standards with her deeply empathetic one-on-one diagnostic model. Viraj bridges a critical gap in men and women's healthcare, driven by her personal journey navigating postpartum recovery. She has developed a rare specialization in prenatal, postnatal, postpartum, and beyond, transforming how patients experience full body healing. Before I even ask her any questions, I just want to say I know we've had this conversation before, Viraj, and I have been trying to spread this message to women postpartum that in other countries you are automatically required to go to a pelvic floor specialist after you have your baby. That's how important it is.
Yes. It is. Like in Europe, you have a baby and you and your baby go to physical therapy because actually the baby needs physical therapy, a specialized type of physical therapy. And the mom needs pelvic floor physical therapy because the mom's trying to care for the baby and get back into her fitness program. And so I think that's amazing. I think that's something that maybe we are on the way.
Okay. That's good to hear. Because I was like, why don't we do that?
Yes. I think it starts with education. I think more and more people are becoming aware of that.
Okay. Well, let's learn a little bit more about you. So what initially drew you? I know I think I know your story, but I want to share it with our audience. What drew you to your specialty?
Yeah. So I've had a love for science for years, like ever since I was little. And so I went to physical therapy school and I graduated 2004. And so I quickly started at orthopedic and sports medicine facilities called National Rehabilitation Hospital. And I learned two things that during that small span of time that really kind of paved the way to me starting my own business today. One of the things is that I got introduced to Pilates. And so my manager at the time, she really rare to see like a reformer and a Cadillac in a physical therapy studio, but no one was ever using it. We used to actually put patients on and use it as like a place for them to lie down and put hot packs and cold packs and e-stim on. Like it was literally not used for Pilates ever. And so I became curious about this because at that time I was seeing 75% low back pain patients. And then I quickly learned that Pilates, Joseph Pilates, was actually using Pilates as a method to rehab soldiers from wounded soldiers from war. And so he's really ultimately like a PT, right? And so I decided to, at that point, there was no like PTs, like no PT boot camp or any kind of big studios or anything like that, very small boutiques. And I ended up getting my Pilates certification. And it took a year and a half. And I was certified in all the machines and then also in mat. And I quickly started putting that and incorporating that into my physical therapy program and started seeing huge results in my low back pain patients. And so really what I got from that is a whole body approach to healing, which it should be. It's not just one body part. How powerful breath can be when it comes to rehabilitating the core. And it really made me an expert at cueing and teaching these muscles that are so deep inside of your body that it really takes some finesse to kind of get to those muscles. And so that has stayed with me as I've started my practice. And then the other thing was a colleague of mine, she was starting physical therapy, or she had her own clients there, and she was getting like all the hard clients, like the ones that had like chronic pain, weren't getting anywhere with their rehab, just the hard to rehab clients. And she was actually getting them better. And she was doing a different type of physical therapy that I didn't really understand or know about in physical therapy school. And because of her, I took my first class through the Postural Restoration Institute. It's founded by Ron Hureska, an institute in Nebraska. And it really helped me. And now I'm like 200 hours in and 13 classes in. But being a student in their institute has really helped me shift the way that I look at the body when it comes to rehab. And I look at more what is triggering and causing the issue. And this could be anything. It could be an ankle issue. It could be a shoulder issue. It could be a pelvic floor issue. I'm looking for the root cause. And so the combination of the postural restoration and getting to the root cause of what's going on, and then the whole body approach is something that I've integrated into my practice today.
That explains so much. That really explains why you are so good at what you do. And can you tell us, like, what types of cases do you most typically work with?
Yeah, so I specialize in pelvic floor physical therapy, orthopedic injury and rehabilitation, and then preventative health and wellness. And what that means is with pelvic floor physical therapy, I do internal pelvic floor work, which sometimes women do need to rehab from pelvic floor issues. And this could be anything that could happen during pregnancy. I support women during pregnancy and support a good labor and delivery, postpartum, any issues that might happen as far as like a prolapse or any kind of diastasis recti, or they just want to start lifting weights again and running. I also help women perimenopause and beyond, and the shifts that they're going through there. Orthopedic wise, really anything musculoskeletal. I see a lot of hip impingement. I love working with the spine with my Pilates background. The machines are phenomenal to help rehab and prevent surgery from any kind of disc issues, low back pain, sciatica. And then preventative wise, this is something I want people to know. Like, you can come see me before you have an injury. And that's part of the reason I started my own business, is like people were coming to me like reactively. It's like, oh, I've had this pain for this long, help me feel better. And that's fine and all, but I want to educate the population, be like, hey, say you're a woman that just had a baby and you want to start lifting weights again. Come and see me. I can do a fitness evaluation to see if your muscles are actually working the way they should to load your body to do a squat, or you're running the way you should to prevent like leakage issues in the future. So come and see me and just get a quick eval. And if something's off, let me give you a couple exercises and let's send you on your way and start pushing your weights, because that's what you need to be doing. And maybe that can prevent things from like stirring up later on down the road too. So, and this is beneficial for my women who are dealing with osteoporosis or preventing osteoporosis and want to start lifting later in life. If you've never lifted before, you've never started like any exercises, let me show you, is your body in the right position? Are you recruiting the way you should? Are you breathing the way you should? And then get into your program. So, yeah.
Yeah, that's what Sue had said specifically that was really unique in working with you, was the breath. And she felt like as instructors, we should know more about the breath, or cueing the breath. And I mean, it's hard when you're teaching a big class, obviously, you're looking at form, you're looking at mechanics, there's so many things you're looking at, effort, but I'd love for you to just share more about the breath.
So that is my passion, and it is a very underutilized aspect of a pelvic floor rehabilitation or any kind of orthopedic injury program. And really, because breath, meaning the muscle that does the breathing, is your diaphragm, and it's a muscle. Right. But it's a muscle that, because of our asymmetry, us as we at the Postural Restoration Institute, we see the body as very asymmetrical. We have 3 lobes of lungs on our right, 2 lobes of lungs on our left. We have a huge liver on our right. We don't have a liver on our left. So it's honestly like our respiratory system, circulatory system, it's networked more on the right. And so because of this, it creates like, imagine I have a 5-pound weight here and 0 here. I'm just going to I'm going to be a little bit heavier on this side, and I might pattern in a certain way. And because of that, we don't use our diaphragm on both sides of our body equally. So when I cue, and I can kind of take you through, well, one of the things that I assess during an initial evaluation that's different than traditional PT is I'm looking at how well you can exhale. And some people exhale like a short, like, well, I don't feel like you got a lot of excursion in that diaphragm at all, because you should be able to have a long exhale. Inhale, they might inhale from their neck. Well, I don't feel like you did anything at the diaphragm. Sure, your neck muscles lifted that up. So I really kind of assess the rib cage. I assess this patterning going on in their body. And then I teach them using straws, sometimes balloons, and you've seen me do that, to actually strengthen this muscle. And when this muscle comes back online, you level up in the amount of core strength and the way that you're using your body to support yourself when you're doing like lifts. Immediately. Yeah.
Yeah. That's incredibly interesting to me. So tell us, like, what a typical session would typically look like with you. So if I came to see you, what would we do?
So initial evaluation, if you were coming in for the first time, I would ask you to spend some really good time on your health and history form, because I want to know about your childhood. I want to know like your orthopedic or your orthodontic history. I want to know of any childhood illnesses. I want to know about any fractures or anything that you did, just sprains, because all of that plays a big role into how I see you on the day that you arrive. I'm already forming a picture of like, okay, what you look like. I will tell you to bring your sneakers, because I do a sneaker evaluation, and this is different than what you might see at like a shoe sporting wear place, but it's not a lot of pronation and supination or support I'm looking for. I believe that footwear actually helps to position your pelvis, your rib cage, and your head and neck in a good position, which drives your walking and walking patterns, and also then your lifting and moving and running patterns. So I will do a sneaker evaluation when you come in, and I'll be able to tell you, hey, these sneakers are working for your body, or hey, you might need a different pair of sneakers that might be able to help support your core and these muscles a little bit better. I already talked about a breathing evaluation, and then we do functional fitness screens, we do strength screens, and then we'll do a little bit of treatment at the same time. So you'll be able to leave with a prognosis, like, okay, sure, you have an ankle sprain, but I'm going to be able to tell you why you have an ankle sprain. And like, I might be telling you things like, your body is patterning this way. Let's get you out of this pattern to maybe address this ankle and maybe prevent something else from happening. And then you're going to get a diagnosis, and then you're going to start a treatment plan with me. Something really cool that I offer is when I was in a traditional physical therapy environment, my patients would always complain because I would give them like sheets of like homework, or like sometimes we'd have an app and it would be just like this AI version of a person doing the exercises in a whole list. But I have my own app where my home exercises are me. And so I'm doing the exercises, I'm doing the breathing with them. We're doing it together. So they have like they're looking at me doing it. They've got the verbal cues, and they know exactly what to do when they leave here.
Do you have them do exercises?
Uh-huh.
Okay.
Yes. You mean like your first visit?
Well, just in general, like if someone were to become a patient of yours where you were going to do multiple sessions, would you incorporate exercise into it? Meaning just like to help them incorporate the breathing and so you could watch them, make sure that they're.
Yeah. So my treatment sessions would be coming in, and you would get some manual therapy. And so what manual therapy looks like for me is I'm going to help, if you're not breathing well, we're going to be doing a lot of rib cage stuff on the machines and on the Pilates machines to help your ribs move a little bit better so that you can get that full inhale and exhale. Sometimes you can't breathe, and especially with a lot of pelvic floor clients, I see ribs that are like just sunken in because they've spent so much time breathing with their neck and because of postural changes. So when they breathe, they're actually bearing down in their belly, breathing into their pelvic floor. And so it's not enough for me to just teach them okay, inhale and exhale. I got to get their ribs to like move so they can, so their lungs can inflate. So that's where I use a lot of the clinical Pilates and get them on the machines and get their ribs to start moving. We might do some dry needling. We'll definitely get on the machines and work on the breathing. And then we do exercises. We're doing exercises together. And then that becomes part of their home exercise program.
Okay. Very interesting. This is curious and more personal, but I'm just curious because I experience sometimes it's hard for me to breathe. I say it in my class. I'm like, I'm having a hard time breathing when I'm doing a particular exercise. Sometimes I'm on and it's right and I know it's right and everything feels right, but sometimes I'm off and I don't know if it's a mind thing or if it's a, would you have any thoughts on that?
Is it when you're teaching?
Yeah, or even like if I'm taking a yoga class, sometimes I feel very connected. I'm like, I am nailing this. Like I am really good. And then sometimes I just can't breathe right. So it could be more in my head.
So it could be that you might have some weakness in different parts of your diaphragm, right? And so what I see most often is that people are not breathing through the back of their spine. Your diaphragm is like a bowl around your whole entire rib cage. And so a lot of the time people focus on the belly part and the front part, or even more the lateral. So I'm looking at lateral excursion, meaning side to side. So inhaling with your, like inhaling, pushing your ribs outward that way. And then if you go on my website or if you see any of my Instagram reels, I always have people reaching. And so when people reach, that opens up the posterior part. And so that's a very underutilized part of your diaphragm. And so you probably need some better access there so you could use that to get more airflow. Yeah.
Okay. I'm gonna have to
okay. Got to train you.
I know of one in particular, but I'm sure you have hundreds. Is there a patient or success story that's kind of stuck with you?
I had a patient of mine. She was a spinal cord injury patient. So she had, at the age of 18, she dove into a swimming pool and snapped her neck and at C4. And so I had seen her later in her life at like 50, but she was spinal cord injury, walked into my clinic, and she had fallen. And so she broke her C3, C4, and she had just gone through a fusion. And she was very nervous because, I mean, it's right at the site of her spinal cord injury. So we started working together. I was working on rehabbing her. And then I used Pilates. When we got to the strength part, we got her on the reformer and we started doing exercises on the machines. That was amazing to see because she was able to use her whole entire body, her breath work, her breathing, her core. She had never been on a Pilates machine before. She never thought she could experience something like that. And I was able to offer that up with her. And she found herself starting to walk better, starting to sense and feel her core. She got so inspired, she bought a reformer. And then she started educating the community because she was big on disability and having disabled people be incorporated. Because I had her come to my group classes. I would just modify things. This was a few years back. And it literally, she wrote a book and it's called I'm Going to Walk. And there was an excerpt I was able to write in her book and talk about that phase of her life. It was a memoir, a phase of her life. And that was the first time that I had inspired someone. I had seen how much I had inspired someone. She thought she was coming here for just neck pain. And she found a whole new type of fitness, got into the fitness world and found a way to strengthen her body that was working for her. And she started inspiring other people. And I just saw the transformational effects, I'm sure you can relate, of what it means to shift someone, transform them, and then make a bigger impact in the community. And so that just really inspired me to want to do more. She would always say, Viraj, you need to talk. She's like, you need to talk to more people. She's like, because you have so much information, you need to share it with other people and educate them and inspire them. And so that really motivates me to this day to what I do.
Wow. That's truly life-changing. And seeing her body in a different way, going from like more of like a surviving to a thriving. That's just incredible. And then wanting other people to do the same. Because when something good happens to us, we want that's for other people. That's human nature, which I think is a beautiful, beautiful thing. Okay, so this is a big topic in my community, and I'm sure it is in your community as well. The changes that we see in our 30s and 40s and 50s for both men and women. What are some common red flags that should prompt someone to make an appointment to come visit you?
Yeah. So 30s, 40s, and 50s. I'm glad you said men and women, because men and women are going through shifts and changes differently. The root cause is the same, or the cause is the same, but maybe the root cause is a little different, I should say. So I'm going to tackle like women first. So women, I see like 3 categories of women that are at risk and have some red flags. So women over the age of 35, and I say 35 because it is now known that perimenopause, this phase of life that precedes menopause, can last about 10 years before, spans 10 years. And there are these shifts that happen in our hormone levels. And the gradual shift isn't up and down, but it's in a downward slope, eventually going towards menopause. The problem is that estrogen, as that starts to decline, because it's everywhere, the receptors are everywhere in our body. They're in our brain, they're in our heart, they're in our joints, and in our muscles. And so because of that drop in the estrogen, the ligaments end up becoming lax, the connective tissue there. And so now that pelvis that was maybe stable at once is starting to shift again. And that pelvis that holds your pelvic floor organs and also pelvic floor muscles are not supporting you the way they should. So I say 35 because you're not thinking about perimenopause at 35. I feel like I was going through perimenopause stuff after I had my kids. I just didn't know it. And things have shifted and changed, and it did definitely played a role with what I was going through. So just educating people about that. And then the other group of women that kind of go through this are people who have had C-sections or people who have had vaginal births. And so, like you said before, pelvic floor therapy, PT, if you didn't get it before, well, you might have some issues here and some pelvic floor issues coming about as you age. And then the other group of women that I see is women who have hypermobility issues like EDS, Ehlers-Danlos syndrome, and also autoimmune. I think that's a big thing with women. Autoimmune disease causes inflammatory and inflammation in your body, which then again affect your pelvic floor. So with these women, I see 3 specific things. I see an urge incontinence issue, which is the sensation of needing to go pee and you cannot hold yourself and you end up having a little bit of an accident. Okay, so that's not normal. It's common. It's not normal. Stress incontinence, which is, this is like if you cough or if you sneeze or if you're running, if you're jumping, doing box jumps in the gym, you start to have some leakage. That's not normal. And then other symptoms are a feeling of pressure in your pelvic floor. That could signify a prolapse. And a prolapse means your pelvic organs are starting to come out through your pelvic floor region. For example, uterus. The uterus is at the top of the vagina. It can, because it's held together by connective tissue, if it becomes lax, well, it starts to drop down. And then you've got a bladder and a rectum on either side of your vaginal walls. They can start protruding into the walls of the vagina and you start to feel this pressure. And so those symptoms should not be ignored. Those are red flags that, hey, this is not going to go away. You talk to your friend about it and they're like, oh yeah, I had the same thing. It doesn't matter. You need to speak up, get to a pelvic floor PT ASAP. With men, I see some different stuff going on, and they actually have some pressure system or pelvic floor stuff going on as well, but it shows up differently. For them, they'll have sciatica, they'll have deep glute pain, they'll have hip, like really tight, like IT bands. If you see a guy like rolling out his IT bands like crazy all the time, like the hip tendonitis or impingement there. And then maybe some direct things at the pelvic floor as well, like urinary incontinence in that maybe they're going to the bathroom and then they aren't having a full elimination of urine. Or maybe after they go, they're like dribbling a little bit. So those are direct issues at the pelvic floor. And for them, it's because they grip and they squeeze through the ribs when they lift weights. These are like my highly athletic, my guys who are like working out 7 days a week, lifting really, really heavy weights. They're not stretching. They're not recovering the way they should. Maybe they're sitting at their jobs 10 hours a day. So they have these pelvic floor issues, which can turn into problems as well. And so the problem is these women and these men do not talk about it to anyone, and then they just back away from their current fitness, right? They won't go to the gym anymore. They'll stop squatting. They'll stop lifting weights. They won't progress their weights. They won't go to the gym anymore because they're nervous and they're scared. I have so many women that come in here. They're like, oh yeah, I stopped going to the gym. I'm so scared to go. I don't know what to do. If I squat, I feel this. And that's horrible because they need to be in the gym. They need to be lifting weights. They need to work on their bone strength and muscle strength. And it's frustrating to me because they'll go to their primary care who sends them to OB, to a Urogyn, and it'll be like months before they see me and they've been out of the gym for months. So really telling people to like, hey, it's common, get it checked out, go see a pelvic floor PT, get your exercises and get back to the gym, because you cannot, and people always ask me, well, how long do I go to the gym? For life. This is a lifetime. This is where you belong. You don't stop.
Oh, okay. I have two questions. One is, I don't hear it as much now, and maybe it's because of the demographics of my community, but when I first started teaching, I would hear all the time from women that if they jumped or they did certain things that, like you mentioned, that they would pee a little, they would say, or, when I can't do that, I pee. But then I had some women that had a procedure. And as you were talking, I was like, wait a minute, should they have had that procedure, or should they have gone to a pelvic floor rather than is the problem fixed, or is the problem have a Band-Aid on it?
That's a really good question. So I believe that pelvic floor issues is not just a pelvic floor issue. And I do think that sometimes if it's being treated as just a pelvic floor issue and not this dynamic issue of this pressure system inside of your body, and I know you've heard me talk about it, because the pelvic floor muscles are just one part of this foursome of muscles, canister of muscles inside of your body that work together to support your pelvic floor. And so I can kind of tell you about that really quick. I'm just going to educate you a little bit. I have to bring my can of beans. My patients are like sometimes who don't know me, they're like, why does she have like a can of beans in her like PT office? But basically this canister is under pressure, right? There's no beans that are coming out. We have our own pressure system inside of our body. Okay. So the top part of our pressure system under our ribs is our diaphragm. The bottom part is our pelvic floor muscles. And there's not just one, there's many of them underneath here. The diaphragm and the pelvic floor, when they are positioned really well, they move up and down together like this. So when you exhale, actually the pelvic floor muscles and the diaphragm come up. And when you inhale, they open up like this. That creates power and core strength. When I think of core strength, that is power and core strength that's generated inside. In the front of your can of beans is your transverse abdominis muscle. That's your corset-like muscle that kind of holds your organs in. And in the back is your multifidi muscle. So all four of those muscles create this pressure inside of your body. So now if you go in and say you have a pelvic floor issue and say you get a pessary put in there, a pessary is a device that can help to support your prolapse, or if you get some kind of surgery that helps to support and position the prolapse, and you've managed this, but you still need to strengthen it. You still need to strengthen the muscles here. But you haven't managed this diaphragm that might be stuck like cooking. You might be breathing with your head and neck and back, and it's not working. You maybe did not restore, and you have no idea what a transverse abdominis feels like and what it feels like to lift and bend and move and lift with it. And multifidi is kind of easy. Those muscles are usually pretty strong in the back. But if you don't restore and get access to these muscles when you're moving, you can cause more pressure down in that area. If you're not breathing the way you should, you can cause low back pain issues. Something's going to give. Something's going to give in this contraption. And I'll see hip impingement. I'll see low back pain because it's still weak. You got to train the whole entire system. So I do believe that it is incomplete. And I think that you should encourage your doctors, say, I really want to see a pelvic floor therapist that not only is doing internal work, but that really understands the anatomy and the deep amount of strengthening that you need to do. Because what I see is I have a lot of pelvic floor clients who are like, I have no idea. I've been to pelvic floor therapy. I have no idea what my TA does. I don't know how to breathe at all. And that's incomplete to me. And that's not, and then they're so frustrated because they spent so much time and energy. So I'm glad you brought that up.
Yeah. Okay. Thank you. That was a great answer. My next question, I don't think you mentioned it as one of the top three, and I guess this could be for men and women. And this is me, just personal. I know that I use the bathroom way too much. I pee 8 to 10 times a day, and I know that that is not acceptable or normal. And I don't know, is that something that you could treat?
Yeah. And so that's more, we have to figure out the origin of that problem. And so the origin of that problem might take doing an internal pelvic floor examination, because sometimes if the muscles in the pelvic floor are too tight, and they are not tight, meaning they dome up like this, and they're not doing their full, the power comes from tightening and then relaxing. So if there's too much tightness here, that might need to manually be released so that, and you put onto an exercise program so that those muscles can go like this while you inhale and then exhale. This creates power and support at your pelvic floor organs. The other thing, at the bladder, your bladder might be, for whatever reason, not fully, it's getting the wrong signals from your nervous system. And so it might be maybe 25% full, and then all of a sudden, for some reason, your body is encouraging you to go to the bathroom, and then maybe you're emptying like 25%. You're like, oh, that was it, and then you have to keep going. So that's more working on your nervous system. And again, that would probably bring me back to more your diaphragm and working on, is your diaphragm working the way it should? Because your diaphragm controls a lot of that parasympathetic nervous system, which helps your nerves that go into your bladder chill out a little bit. Your bladder's spazzing out a little bit for some reason and is getting the wrong information. Maybe you trained it that way. I don't know. Or maybe it just happens nervous system wise. It's one of those things that can happen as well. So trying to figure out the origin of where it's coming from. I do have patients do a bowel and bladder diary for me. And that's where you write down when you're going to the bathroom, how much you're drinking, how much you're eating if we're looking at your bowels, because that can play a role as well. And then that gives me information. I'm able to kind of rule out okay, what's making her go? Is she drinking a lot? Oh, another thing is this is what I see also, is that people who are drinking all day long, you might want to maybe drink a good amount in the morning at 8 a.m. and maybe go 2 hours or so and then drink a little bit more at 10 a.m. and go a couple hours. The fact that you're maybe drinking a little bit too much all day long is triggering that issue even more, because your brain is oh, I gotta go. Right. And so that's something that can be helpful. But having that diary really gives me a plan as to, okay, where do we have to go? Is it something nervous system that we need to work on? Do we have to retrain the bladder? Do we have to go in and do some manual work?
And I will say this, and this is probably a different question, but I forgot, I did acupuncture for something. Maybe it was tennis elbow or something. And one of the questions was, do you wake up in the night and go to the bathroom? I'm like, yes, of course. And he was like, that's not normal. I'm like, yes, it is.
Yeah.
He's like, no. He's like, that needs to be treated. So and also knowing that for most people that I know, it's something as they age. They don't do it when they're younger, but as they age, then they get up and go to the bathroom. So
yes, common but not normal, because we need that 8 hours of restorative sleep for so many other things that are going on in our body. And for us to be woken up like that, it's not great. And so again, getting to the bottom of hey, did you want to maybe stop if you're drinking water until 10 p.m.? Mm-hmm. Did you want to stop a couple hours before, or something like that, trying to figure out why.
Yeah, I think that what you said about the sips throughout the day, I have 3 drinks going at all times. I'm constant input. I've always been that way. I know. So that makes sense. Cause yeah. And I personally think I do have a full bladder. It's not but that doesn't make it right. I know it's not right.
Yes. Mm-hmm.
Yeah. Okay. Yeah. All right. Let's move on, because I could make this a personal session. And, I will make an appointment to do that. Right. So when people hear pelvic floor, they usually assume that it's just something for women, and you kind of talked about that it's something that men need to think about as well. Do you want to talk about that a little bit more?
Yeah. And so some of the symptoms that I had said earlier, like the low back pain, the deep glute pain, maybe some issues when you're urinating, those types of symptoms, usually for men, they have tight pelvic floors. And again, their anatomy is a little different. Everything's more superficial. So we can easily kind of treat that they don't need an internal exam like a woman would. Our muscles are more internal as well. And so maybe coming in, figuring out, again, root cause, what's driving it, and then giving you some advice on how to manage the driver, and then targeting some exercises to help to, and it's usually tight muscles that I see there, to stretch out the pelvic floor muscles a bit, to learn how to breathe, to coordinate that connection with the diaphragm and the pelvic floor, to learn how to open up the back for that posterior diaphragm to breathe or to move better, the rib cage. So that's where I would kind of go with men. But yes. Oh, and I see a lot of diastasis recti with men, meaning their six-pack muscle is split open. That's not just a female thing. Like after postpartum, as she drinks her big jug of like water.
I'm like self-conscious.
Like that's like the biggest jug I've ever seen. Oh my God.
I just
good for you. So their RA muscle splits open, and that's a problem. That's feeding their back, and they're really vulnerable to spine injury because of that, and hip stuff going on there too. So being aware of doming, like if they're lifting something and they see like a volcano kind of at their belly, that could be a DR, a diastasis recti. They might need to come in and get screened for that and get some exercises to help support it. That's all. That's what we do. And then go back to your gym.
Yeah, I have a lot of men. It might be worthwhile to do like if you were interested, do something like you did for us with the Pilates, something for the guys, talking specifically to them, because we did not get any guy. I think what you did before was specifically for the women. It was targeted towards the women. And
it could be something more like lifting
with
core support. So they don't, I don't know. Sometimes Pilates is like a little too like, I don't know. Men don't get into it as much, but maybe we could definitely target it in a way that like talks to them or speaks to them a bit more.
I think that would be amazing.
Yeah.
Okay. So this is my last question, but then I have one more personal question for you. How does your care complement fitness programs or other providers in multidisciplinary approaches?
Yeah, I love this. That's like the best part of having a business. I don't know how you feel about it. It's just being able to get out there and connect with others who are just as passionate about health and healing, to learn from them and to be able to offer and get them to understand your approach as well. I think it takes a village to heal. And I think it takes a village to heal people. And I think it takes a village to keep people fit and healthy. And I think that they need that support, right? The more that we talk and we interact, the more the patient is going to thrive. And so that is at the heart of my business. And I love doing things like that.
Yeah, that's great. And I couldn't agree more. And it was lovely to connect with you last year. And I know you connected we have some mutual connections and I think that's great. And you're in I should have said before, your office is in Brambleton. Is that right? Brambleton. Okay. Yeah. So super close for us. I mean, that's as close as you're going to get. I'll share, years ago, I looked for a pelvic floor before I knew you, and I went out to Reston, and I loved her. I used to record our sessions together and put them on the community page because she would make me work out. I would get there and I'd be like, I just finished a workout. She's like, nope, we're lunging, we're squatting, we're doing. So she was excellent. I mean, she was to your point, she was very thorough as far as like it was a 2-hour appointment because that's what she thought I needed.
Yes, you needed 2 hours of therapy. Yes.
But she was very funny. And then she gave your homework, same thing. But it's very difficult to find someone with your level of expertise. And honestly, like I'd never really recommended her to other people because I thought it was a bit too much, to be honest. I mean, 2 hours felt like a lot for the average person. But yeah, so now I've been able to refer so many of our clients to you, and every single person, as I mentioned earlier, that I've referred has been like, not, oh my, it was good. It's like, oh my God, she's amazing. Like, wow, she's a miracle worker. Like that's life changing. That's the feedback I've gotten from some of our, I'll say tough cookies, like someone that you don't necessarily expect you'd get a compliment from. And some of them were pretty desperate too. They were in a really hard place and you really helped them. So very grateful for you.
Yeah.
I would love for you to share a time in your life so the name of this podcast is Start Before You're Ready. And that is something that I encourage people to do rather than wait for this perfect time or wait for the situation to be ideal or whatever it be, just start. Can you think of a time in your life that you started before you're ready?
I probably have to say when I was fresh out of PT school, and I was considering for a very long time getting my Pilates certification. That was a little nerve-wracking for me because I'm like, I spent 7 years of my life becoming a physical therapist. I'm about to spend a good amount of money and a good amount of time learning something completely new. I'm working full time. Am I ready to take on this whole new, I never thought I'd be getting a certification for something completely different in like fitness. And so I remember it was pretty intimidating for me, and I did it. I put the money down and I was committed, and I had to get my body in shape, Pilates shape. So I remember spending hours I was doing Bikram yoga at the time, and because I had to do all these moves and I had to perform and get on these machines. And I think that is the number one, the best thing that I ever did, because I think it was me.
Yeah, it's a great example. And do you teach any Pilates classes, or do you just put it into your practice? I know you did teach before.
Yeah, so I had my own Pilates business. As soon as I got my certification, it's always been with me. It's kind of been a lifestyle business. It's always been after PT, come and see me. Currently, I'm focusing more on my physical therapy practice over the past year and a half. And so, but with that being said, I do see Pilates clients, and usually by referral, they'll come to me and be like, oh, can you do it? And yes, I do. And so, but just so you know, it is very different. I do clinical Pilates, that's more, you're working with a person with a degree, physical therapist. So it's very, very performance based, and very individualized. But, yeah, I love it. I love it in the fitness aspect of it and the clinical part of it too.
That's great. And I think that it is really impressive that to hear someone like you say that you took the Pilates certification so seriously. I mean, just the amount, I know what you've been through as far as your education, and that was something that you still considered to be important. I really valued you saying that, because it is true. All the disciplines are different, but there's value to what everybody brings to the table, and whether it be, and I am a big believer that there's no modality that's like perfect, or that there's nothing that's right and there's nothing that's wrong. It's what you like and it's what you do, and it's what your body will cooperate with you the most with, or it really comes down to what you'll do, because if you don't do it, it's not going to work, right?
Yes, 100%, 100%. And thank you for everything that you're doing in the community. I mean, I think that it's amazing. I mean, I follow you, and all the encouragement that you give your students, the amount of information and the passion that you give them nutrition wise, and like to be held accountable for their fitness and their health, it is very inspiring. So I love what you're doing with the community. And then this podcast, I think this just pulls everything together, and this is what people need. This is what people need.
Viraj. Well, thank you very much.
Yeah.
So we're going to have you back into the studio after this, because I'm going to tell you right now, people are going to be begging me. But I'm sure you are also going to have some students visit you, because I do think that what you said is really important, that something doesn't necessarily have to be broken to go. I mean, we all probably have something that's broken, but it just to be assessed and to be evaluated and to be given direction that will help them prevent themselves from potential injury in the future is worth its weight in gold. And that's something that I believe wholeheartedly.
100%. Because your main goal in life is to be healthy. You got to have your fitness. You got to have your body. And so you've got to be working out. And so whatever you can do to maximize that.
That's absolutely right. We only get one. Well, awesome. This has been an awesome conversation. I really appreciate your time today, and I look forward to seeing you soon.
All right. Thanks so much, Kelly.
Thank you for tuning in to another episode of Start Before You're Ready. If you enjoyed this episode, please subscribe, leave a review, and share with a friend who might need a little motivation. Ready to start your own journey? Check out our workouts and nutrition coaching programs at kellysbootcamp.net. You can choose from in-person sessions or virtual programs. Set up a complimentary coaching session to get started. Follow along with me and the show on social media at Kelly's_bootcamp. Until next time, this is Kelly Young reminding you that the best time to start is always now.